All right, welcome to Deuk Spine Institute. Our patient has back pain. He travels here from Missouri. He's injured his lower back in an accident, and he actually injured his neck too. So we'll be fixing his neck in a few days, but today it's just the lower back. He's got herniated discs at L4-5 and L5-S1. So we're going to go ahead and get started by fixing these two discs, L4-5 and L5-S1. If you have questions, feel free to ask during the surgery. I will take your questions during the surgery. All right, first thing I have to do is get myself down to the herniated disc at L5-S1, which happens to be the most difficult disc to get to because of anatomy. Sean? But we're going to get there. I think we're off on orbit just a little bit. Sean? That might be better there, yes. AP. So I always start with L5-S1 if I'm including L5-S1 in the surgical plan. The reason is the incision for L5-S1 is the most difficult. The entry point is the most difficult. So I'm going to try to get into the L5-S1. Perfect. Once you're in L5-S1 with your needle, then L4-5 is much easier, and usually you can enter 4-5 at the same incision as 5-1. All right. If you have questions, feel free to ask. Again, our patient has discogenic back pain, which is back pain from a disc herniation at L4-5 and L5-S1. Anthony, let's show the audience the 30 different causes of back pain that we commonly see here at Deuk Spine. I'm Dr. R. Deukmedjian with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk Laser Disc Repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deukmedjian. Thanks for joining us. Welcome back. You can see there are 30 very specific causes to people's back pain. 99% of doctors have no clue how to diagnose back pain. It's the truth. You may not like me, but in the end, I'm probably the best in the world at diagnosing what causes people's back pain. And that's okay. You don't have to like me for me to fix your back. But in the end, the reality is you either choose to live with your back pain the rest of your life and let it limit your life, let it limit everything you do, let it make you suffer when it feels like making you suffer, or you choose to come here to Deuk Spine Institute in Florida and have us get rid of your back pain. We can cure 99% of back pain with our treatments. Not 100%, 99%. But it all starts with our free MRI review. So we're willing to give you a free MRI review, no charge to you or anybody else that wants it. And during this MRI review, we're going to figure out why you have back pain. And we're going to give you a recommendation for treatment. Currently, you can look down this tube, and what you see is the L5S1 disc. This is the annular tear. The red stuff is inflammation. This should not be here. It should be white, not red. The red color indicates inflammatory tissue, bleeding, neoneurulation, neovascularization, and the development of granulation tissue, scar tissue, happening right here inside this L5S1 disc. Why is this happening? You may ask. The answer is simple. He injured his disc in a car accident. As a result of the automobile accident, this patient has back pain. He has a disc injury. The disc injury starts with an annular tear and fragmentation, crushing fragmentation of the nucleus pulposus. Over time, the fragments of nuclear material end up leaving the disc center and migrating out through the annular tear under pressure of normal activities like bending, lifting, twisting. Regular gardening, working, exercising will push out fragments that you created during your accident when your bones crush down on the nucleus. So as these fragments of nuclear material start to go into the tear, they cause horrible inflammatory reaction. Your body starts to attack those fragments, trying to get rid of them. I figured this out. This was discovered by myself, Dr. Deukmedjian, CEO and founder of Deuk Spine. And as such, I developed treatments that are directed specifically at the annular tear. And I published those results in the National Library of Medicine in a publication initially called Surgical Neurology International. This was a prestigious neurosurgical publication with the chief editor being Dr. James Osman, Professor Emeritus of Neurosurgery at UCLA. And Dr. Osman published my results because he believed the world should see the truth. Okay? Dr. Osman is a true scientist. He's retired now. And he was sick and tired of seeing the lies that are being published today in the medical peer-reviewed journals. Lies that are basically false information being published at the behest of insurance companies and pharmaceutical companies, spinal device companies. They have taken over control of our scientific literature, and they're now publishing fake studies, fake results, fake information, so that they can sell their spinal cord stimulators and medical devices to you, the patients, and have your insurance pay for them. Well, people who have spinal cord stimulators put in for back pain, they generally don't do well. I've seen many of them, and they're still having the same pain they had before. There's one thing that's changed after they get their spinal cord stimulator put in, and that one thing is that the doctor is a hell of a lot richer. Any questions from our audience?
No questions.
Let's show our video on how these herniated discs can become so painful after they've been injured.
Disc injuries start with an annular tear. Damaged nucleus, pulposus, herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Kimmy? Inflammatory tissue right there. This is exactly where the pain comes from, that red stuff. And that's what we've been removing with the laser. Why do people develop inflammatory tissue in their disc within the annular tear? The reason is simple. The nucleus pulposus herniates out. It gets stuck within the annular tear. Your body tries to get rid of it through a process called inflammation. It's basically using war. And unfortunately, a lot of times war doesn't work. It just causes destruction. People die, buildings get destroyed, infrastructure gets ruined. It costs tremendous amount of money, and in the end, nobody's happy. It's a lot like litigation. The lawyers make out like bandits, everyone else pays a price. So, long story short, his body has been attacking this herniation for years. And here we are fixing it for him. All right. Just about done. Just a few seconds left. Is he light? You sure? Any questions from the audience? We just finished L5S1. It looked beautiful.
No questions.
Come on in, Jordan. We're going to move to L45. Let's show the audience how we repair lumbar disc herniations with a laser.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 34969.
All right, welcome back. We are currently in the process of removing our dilator. This is L45. Any questions from our audience?
No questions.
Laser. He's been a bit challenging for a couple of reasons. Look at how much scar tissue is inside this annulus tear. This is, on a scale of 1 to 10, it's a 9. It is so thick. And the laser, you're seeing the laser just cut right through it, which is impressive. The laser is really good at cutting through scar tissue. However, there should be no scar tissue here, normally. In this patient, he injured his disc in a bad accident. They've torn, they've herniated, and over the last, how many years has he had? 4 years, back pain? His body has been desperately trying to clear out this problem right here in the back of this disc. Unfortunately, like everyone, he's unable to eliminate the herniation. Your inflammatory system, which is the part of your body responsible for fixing this disc herniation, is not capable of repairing a disc herniation. So it requires either divine intervention or man-made intervention. And he's getting the man-made interventional. God led him to us and then empowered us with the ability to help him with this pain. And that's what we're doing. Hold it right there. So we are clearing out the scar tissue, the herniation, all at the L45 on the right side. This is also where the nerves going down his legs were being pinched, right in this area of the neuroforamen and lateral recess. So we're able to treat 2 problems with 1 surgery. We're able to get rid of the back pain by doing an annular tear debridement. We're able to get rid of the leg symptoms by decompressing the nerve root. Any other questions?
No questions.
See the blue stuff? That's your herniation right there. It stains blue with our dye. Just about done. We only have another 2 minutes left. So we've shown our video on how disc injuries cause back pain.
Yes, we
and
have.
how we repair these damaged, painful discs with Deuk Laser Disc Repair, our version of laser spine surgery.
Yes, we have.
All right, very good. Have we done our video comparing our treatment to the other invasive treatments available?
No, we have not.
All right. Let's go ahead and do that. Kimmy, can you take care of that for me? Hi, I'm Dr. Deukmedjian. We've just completed our free MRI review with Deuk Spine Institute, and I've diagnosed you with discogenic back pain. The spine is made up of many bones and joints. It's the joints that are actually the source of back pain. The disc is by far the most common source of back pain, as is in your case. It is the cause of your back pain, the primary cause. In your case, the primary cause of your back pain is an injury to a disc in your lower back that's causing inflammation and hence back pain from the inflammation. Inflammation is the source of all pain in the body, whether it's a broken bone, whether it's an injured joint or an arthritic knee. Pain comes from inflammation. Inflammation is a process where your body is trying to repair a damaged joint, and it creates swelling, tenderness, heat, and pain. The pain you're experiencing in your lower back is primarily coming from a small tear located within the back of the wall of a disc. Now, I may have diagnosed you with more than one disc as the source of your pain, and each of those discs cause pain through the same mechanism. As you see in our video, trauma causes a tear in the back wall of the disc called a posterior annular tear. At the same time, it fragments the nuclear material just inside the wall, and over time, after the injury, you, through activities, push out small fragments of disc herniation into the tear, which then causes cycles of inflammation and pain. And that's why you're experiencing your lower back pain. At some point, your back pain could become permanent and not just reside in your back and not ever leave. But typically people go through a phase where the back pain is cyclical, where it comes and goes, and activities are generally the cause of the back pain flare-ups. In your case, we can fix your back pain by performing a state-of-the-art procedure only available here at Deuk Spine Institute. This is a minimally invasive arthroscopic procedure performed with a laser. This procedure is called the Deuk Laser Disc Repair. We've been performing the Deuk Laser Disc Repair since 2006 here at the Deuk Spine Institute. To date, we've had 0 complications. The Deuk Laser Disc Repair is the safest, most effective treatment for back pain coming from an injured disc like yours. We're recommending you consider the Deuk Laser Disc Repair as your primary and main treatment option to get rid of your back pain quickly and permanently with minimal impact on your life. Recovery from Deuk Laser Disc Repair is just 1 hour. You're going to go back to your hotel after the surgery. You'll spend the night in your hotel recovering, and then in the morning you'll come in for a quick checkup. The checkup usually takes about 30 minutes, and then you can go back home after the checkup. Alternative treatments to the Deuk Laser Disc Repair are far more invasive, and the outcome of those treatments is far more uncertain. There are many surgeons offering treatments such as laminectomy, discectomy, spinal fusion, disc replacement. Other treatments include injecting materials into your spine, such as epidural steroid injection, or injecting material into the disc itself that will supposedly repair the disc. I can tell you, we used to perform these treatments and they don't work. They either don't work or they don't last. And if they do work, they work temporarily, and they're associated with a high complication rate. For example, laminectomy is highly invasive. There's destruction of muscle and bone and ligament in your spine. When the surgeon removes the bones and ligaments out of your spine, it creates tremendous amount of scar tissue and instability of the spine. Patients frequently come back needing spinal fusion. Patients with laminectomy are often in chronic back pain for the rest of their life, going in and out of pain management, on and off of pain pills, and in and out of physical therapy. They frequently require multiple surgeries in order to feel some type of pain relief. An alternative treatment is called a microdiscectomy. Microdiscectomy is another invasive procedure where the surgeon is removing bones and ligaments to get down to a herniated disc that's pinching a nerve root. Microdiscectomy is not a treatment for back pain. It is only recommended for leg weakness stiffness, leg numbness, and leg pain. Microdiscectomy does not fix back pain and should be avoided if you have back pain. Laminectomy does not fix back pain and should be avoided if you have back pain. Spinal fusion is a treatment for back pain. The surgeon must either remove or fuse the disc using hardware such as screws, rods, and bone graft, including cadaver bone graft. You're receiving biological bone graft from a dead person. That's what's allowing your bones to fuse together. Now, these spinal fusions can be quite effective at eliminating discogenic back pain, which is the type of back pain that you have. However, they carry a very high risk of complications. Complications such as blood clots in your legs, which could migrate to your lung and kill you in a process called pulmonary embolism. They also have a high risk of infection. Every patient that does a fusion requires postoperative narcotic opioid pain medication. Opioids are known to be dangerous, addictive, and have a high potential for abuse. You don't want to start opioid painkillers if you can avoid it. With the Deuk Laser Disc Repair procedure that we have recommended for you, there is no need for postoperative opioids. Our patients are treated with a small 7mm incision. That incision has minimal to no bleeding and it heals within a few days. There is no need for narcotic painkillers. If you have the Deuk Laser Disc Repair, we can fix the back pain within 3 days coming from your damaged disc. We recommend you talk to our schedulers. They'll answer any additional questions you have. We'd love to see you here at Deuk Spine Institute and provide you with the highest quality, most advanced treatment in the world that gives you the safest, most effective outcome in the world that lasts a lifetime. Thank you for listening. Welcome back. I'm not going to comment on the video. The entire surgery was done through this tiny little tube. We fixed 2 discs. We saved this patient from having a spinal fusion. He would have had a spinal fusion if he didn't come to Deuk Spine. The entire surgery is done with an endoscope like this. It's a rod lens system. There's a light source, irrigation, suction, and a port for the laser with a camera. And then here's just a few of the pieces of herniations we took out. They all float out through the tube once I release them. The incision is right there. Take a look at this thing. It's literally 7mm. It's tiny. Okay? That's why it's outpatient. That's why our patients don't take pain meds afterwards. It's because it's minimally invasive. This is the best surgery available today in the world for curing the back pain that comes from a herniated disc or bulging disc or degenerated disc. Thanks for joining us. Any questions?
Yes, we have a question from John on YouTube.
Sure, John, I'll take your question. Thanks for joining us, John.
I recently had a 3-level ACDF surgery 2 months ago. My doc said I may be able to go back to work in November. I am a longshoreman. Do you agree with that assessment?
That's a great question. You got to ask your doctor, buddy. If I did your ACDF surgery, you would be back to work in 2 weeks because the way I do the surgery is different. It's honestly better. But other surgeons, I don't know what they do. They use skinny screws, short screws. They use the wrong plate. They don't do the surgery properly. So your recovery may be longer because your surgeon didn't do a great job. I don't know. I'll be honest, but most doctors don't do as good a job as we do here at Deuk Spine. Our patients can go back to full duty with an ACDF in 2 weeks. Thanks for joining us, everyone. It's been a pleasure today. We'll be back Thursday with more spine surgery live streams. Have a great week. Dr. Deukmedjian. I'm here with one of my lovely patients who came to Deuk Spine Institute with a problem with his lower back. I can tell you he's had a laminectomy before. It didn't work. He looked us up, came here yesterday, had the Deuk Laser Disc Repair. We fixed 5 areas on his discs. And how are you doing today?
I'm very emotional. I got home yesterday and the sunset was behind me and my wife took a picture of me thanking God for what happened to me yesterday. I've had back pain since 1973. I got hurt in the Army, putting helicopter blades back on a helicopter. I lived with it for over 50 years, pain. 3 years ago, the VA decided to cut 3 bones off my spine. I've been unstable and on a walker ever since. My life has deteriorated immensely. I was 280 pounds 3 years ago. I'm barely 200 pounds now, and it's not because I wanted to lose the weight. All my muscle is gone because of what happened before.
And did the VA surgery fix your problem?
It made it worse.
That was a laminectomy.
That, when they cut the bones off my spine, whatever you call it. But the thing about it is that after that, it took me 3 years to even get them to, I was at 30% disability to begin with, and it took them 3 years to get me to 80. And then now I'm at 90, but I haven't been able to work. I haven't been able to mow my lawn. I can't ride my Harley Davidson anymore because of the surgery that they did, the instability. I've been in the ER 15 times since that surgery from falls. It's the worst feeling in the world to be a 280-pound farm boy down to 200-pound, very weak-minded, weak strength. I can't get up and go do anything without a walker or somebody with me until yesterday. What you did for me yesterday, there's no amount of thankfulness that I can show you or tell you, except that I took you for a man of your words, and you came through for me. I walked in here without my walker. I've been walking around this morning without my walker, and I don't feel like I'm gonna fall. I'm not afraid anymore. I got hope again. I got hope to be a man again and
Good.
Be self-worth.
You had the Deuk Laser Disc Repair. We went in and fixed 3 discs, but 2 of the discs from both sides because the nerves were being pinched on both sides. And now you're walking without the walker. You feel like a new man.
I feel like a new man, but hopeful to be a great man again. And I thank you with all my heart. My family thanks you.
You're welcome. And you can see in the surgery we did on your back that we went in with the laser and we cleaned out the tears and got rid of the herniations, and now your discs will heal naturally. We didn't put anything artificial in your back. You have your natural spine. You didn't need the laminectomy that the VA did. It was unnecessary, and it put you through a lot of pain and suffering. Are you on any pain medication today?
No, I didn't even take Tylenol for my neck at all. I have no pain anywhere in my body, none. I can feel one spot that it feels like something happened there, but it's not painful at all.
Well, is there anything you want to tell your people out there?
Anybody needs to check with this clinic and this man right here and the staff here is just absolutely unbelievably wonderful. I got treated with so much dignity and fun, actually, yesterday. It was a blast. Anybody that has questions, do not allow people to cut into your back until you do research. And this is where you need to start your research.
Thank you. Thank you.
I appreciate it so much.
Well, we love our patients, and we especially love our veterans who are patients.
This one sure loves you, Moody. Thank you so much.
Take care. You take care.
God bless you all.
Thank you.